Prior to the extraoral and intraoral assessment, the healthcare professional will collect and/or update the health histories, explain the procedure for the exam, discuss its importance to total health, and discuss the benefits and procedures of a frequent self-examination. Prior to the extraoral and intraoral assessment, the client will complete a pre-procedural rinse. Listerine is commonly used. Remove any lipstick or lip gloss, and loosen clothing around the neck area. We will start with the steps of an extraoral examination. Prior to the assessment, the clinician will don necessary PPE, first putting on eyewear, then mask, then she will sanitize, then put on her examination gloves. The extraoral examination will be performed with the client in an upright position. The clinician will carefully observe, inspect the head and neck area, looking for pigmentation, coloration, hair distribution, masses, and/or asymmetry of the face, skin, and eyes. Next, the clinician will stand behind the client and manually palpate the lymph nodes, starting at the submental lymph node area. She will then move back and bilaterally palpate the submandibular lymph node, facial lymph nodes, preauricular lymph nodes, parotid lymph nodes, postauricular lymph nodes, and occipital lymph nodes. At this point, the clinician will then cup the client's chin and turn it to one side. She will then locate the sternocleidomastoid muscle and identify the anterior and posterior cervical chain areas. She will then palpate along this muscle. Once this is done, she will then palpate the supraclavicle lymph nodes. Then she will cup the client's chin and move it to the other side, repeating the same step. Next, she will locate and manually palpate the thyroid gland. If felt, further examine it by gently pushing it on one side of the gland by using bilateral palpating, the opposite side and vice versa. Bilateral palpation is used to examine the temporomandibular joint area by performing the following. Place the index and middle fingers in front of the tragus of the ear, instructing the client to open and close several times slowly. Instructing the client to move from side to side several times. Instructing the client to move in a protrusive manner several times. So first, the clinician will inspect the lips, especially the vermilion borders, for appearance and uniformity. Using bidigital palpation, both the maxillary and mandibular lips will be rolled between the clinician's fingers to feel for thickness or masses.
Oh no, she's here.
The lips are then retracted, which can be done either using fingers, a mouth mirror, or a tongue depressor. And the following structures are observed and inspected: maxillary and labial mucosa and alveolar mucosa, mandibular labial mucosa, alveolar mucosa, mucobuccal folds, and labial farina. Both sides of the mouth are retracted at one time to observe and inspect the following: buccal mucosa and parotid gland papilla, maxillary vestibule, and mandibular vestibule. The client is then instructed to raise the tongue to the roof of their mouth. The client will inspect the area for any abnormalities. Then she will use bimanual palpation to palpate the floor of the mouth to feel for any thickness or masses. Next, the clinician will take a damp 2x2 gauze Next, the clinician will instruct the client to stick her tongue out, and using the gauze will pull the tongue out and look at the lateral borders of the tongue.
Just make sure that you have the ramifications for it. And you're right, it is there to help your posture.
She will also observe the foliate, circumvallate, filiform, and fungiform papilla on the dorsal surface. She will palpate the lateral borders using digital and, if necessary, bidigital palpation. She will then remove the gauze to observe, inspect, and palpate the anterior portion of the tongue. Next, using the dental mouth mirror, she will reflect light onto the hard palate for visual inspection, observation, and then she will palpate digitally with on-off pressure across the entire hard palate.
Move your chin down and try to keep very close. Yeah, so just tuck your chin down and look over the telescope.
The clinician will then grab her hand mirror and instruct the client to say ah. Say ah. While the clinician depresses the middle third of the tongue with the mouth mirror to inspect the soft palate, tonsillar region, and oropharynx areas. This concludes the steps of how to perform appropriate intraoral assessment.